present here, be it the session around strengthening the healthcare workforce, which was immensely helpful. We witnessed how women's health is nation's wealth by Dr. Hema Divakar and team. The nutrition and dietetics session by Dr. Anup Mishra and team was indeed an engaging panel. Lastly, we concluded the day one of the summit with understanding how can we deal with the waterborne diseases with the entire eminent panel. So ladies and gentlemen, for the day two of the summit, we are back with a refreshing lineup of our extraordinary set of speakers who will be delivering around various subjects that aim to our health, well-being, and wellness. So ladies and gentlemen, without further ado, let me start off with the very first session, which is subjected on brain health and well-being. And let me invite our chairperson, Dr. Rajinder K. Dhamija, Director, Institute of Human Behavior and Allied Sciences, Government of NCT of Delhi, to please chair the session. Welcome, sir. Our eminent panelists, Padma Shri Dr. Colonel Prahlad Kumar Sethi, Emeritus Consultant, Advisor and Ex-Chairman, Department of Neurology, Sir Ganga Ram Hospital. Welcome, sir. Padma Shri Dr. Professor B.N. Gangadhar, Senior Professor of Psychiatry and Director of NIMHANS, who will be joining us shortly. Dr. Achal Srivastava, Professor, Department of Neurology, AIIMS, New Delhi. Welcome, sir. Dr. Professor K.S. Anand, Principal Consultant, Dr. RML Hospital, Ministry of Health and Family Welfare, Government of India. Very warm welcome, sir. And as the moderator, I would like to invite our very own Dr. Rajesh Kesari, Founder and Director, Total Care Control, Delhi NCR, and EC member, RSSDI. Over to you, sir.
Thank you so much to SHM for inviting me and inviting all of us. And thank you to the esteemed panelists who are indeed stalwarts in the field of neurology in our country, who are known not only in our country but abroad for the original works that they have done. So thank you so much and welcome to all of you. And thank you so much to all the attendants and delegates who have joined us this morning. So as we all understand the importance of brain, it is not to be reiterated once again. Brain is the chariot. Brain is the organ which is tirelessly, sleeplessly, even when we are sleeping, controlling the various functions of the body. The way we perceive the world, it is through our brain. It is only the brain which helps us perceive, see, smell, taste, enjoy our life, the happiness, the sorrows of the life. All of these come to us through our brain, through the different faculties that converge inside the brain and make the picture of the world as it is. So we have very eminent specialists, and I would request our chairperson, Dr. Dhamija sir, to take over the podium, say a few words, then we'll start our panel discussion. Sir.
Namaskar, good morning to all of you and welcome to this session on brain health on day 2 of Awareness Summit on Illness to Wellness by SHM. So it's my proud privilege and honor to be here this morning amongst you, and I'm grateful to the organizers, Shri Anil Rajputji and his team and SHM for organizing this event and inviting us to talk on a very important subject, which is brain and wellness, about the brain and brain health. So brain, as you know, is a very important organ in the body, which is a powerhouse which controls all the functions in our body. It is like when you drive a car, you need an engine and you need a power, or you need electrical circuits. So brain is also controlling all other organs in addition to the heart, which is a petrol station, but the actual power comes from the brain, and brain is coordinating like a supercomputer. No supercomputer in this world has been even matched with the circuitry of the brain or the brain functions, which are very, very complicated and which are very, very intricate. So we will be, in next 1 hour, we will be talking about how to improve our brain health, what we can do to improve our wellness regarding the brain functions, and how can we prevent the brain-related diseases, so that if our brain is healthy, our whole body is healthy and our whole health is wealth. So it is my privilege to have this galaxy of experts from across Delhi, including Professor one of the most senior most neurologists in the country, Professor Dr. Colonel Sethi, Dr. Achal Srivastava, Dr. Anand, Professor Gangadhar from NIMHANS Bangalore. He is the Vice Chancellor of NIMHANS Bangalore, ex-Vice Chancellor, and currently the President of National Medical Commission, which regulates the medical education in this country. So these are high stalwarts in their field, and by virtue of their experience and work and in the clinics and in the research, they are outstanding clinicians, and they are here to talk about the brain health, various aspects of the brain diseases and how we can improve our brain health. Brain health is now a priority not only in India but across the world. Recently, WHO in its General Assembly in May 2022 passed a resolution asking 200 member states, the countries which are part of the WHO, to make brain health as a priority. So this intersectoral global action plan, GAP, on epilepsy and related neurological disorders is a very important component for all the countries now, and they have mandate to improve the brain health and control the diseases of the brain, including epilepsy. So epilepsy is just one part which is very much prevalent. As you know, there are about 1 crore people living with epilepsy in India. As of now we speak, and these numbers are increasing. And epilepsy, in addition to the mental health issues, has a lot of stigma in the society. People don't talk about epilepsy. People are scared to get married to the people living with epilepsy. So there is a social aspect of brain health or epilepsy or a mental health disorders. So we need to tackle at the community level, and I'm glad that the audience here is very much aware of these disorders and stigma associated with them. And we are here to promote that brain health and how to reduce the stigma so that people can ask for the help, professional help, whether it is in the field of epilepsy or it is in the field of mental health. Like epilepsy, there are other disorders like strokes, which in our country there is a unique problem of young strokes, and not only the young strokes, but the number of strokes have doubled, or the people suffering from strokes have doubled in last 10 years, whereas in the developed countries the number of strokes are reducing. That means they are improving their preventive health or promotive health for the brain, and their numbers of people having strokes are decreasing, while we are in India the numbers are increasing. In India and in addition the other South Asian countries, the numbers of strokes have doubled in last 10 years, and that's because of the number one is the aging population, which we are having now. Population more than 60 years is now 20%, and it's going to double in next 20 years. So obviously these people will have diseases as the people are living beyond 60, 70, 80 years. Not only that, people are also having the lifestyle diseases like diabetes, hypertension, increase in cholesterol levels. So these are also very unique to our country, and we are genetically prone to have more of these diabetes, hypertension and cholesterol, and all of these combined lead to heart attacks and strokes, which are very, very important cause of not only a disease burden, but also mortality or the number of deaths occurring from these disorders. In addition, there are other disorders like Parkinson's disease. We are more than 10 lakhs people living with Parkinson's disease, and these numbers are ever increasing. And these are progressive diseases which do not have any 100% cure, but the disease can be controlled by adequate medication and complementary therapies. But these patients need to have a lifelong follow-up, so these are very important. In addition, young people, particularly women, also suffer from diseases like multiple sclerosis and related disorders, which are demyelinating disorders, which occur in a young, productive population of the country. So we need to talk about that. We need how to help these people, how to prevent these illnesses, not only prevention, but also how to help these people in terms of leading their normal activities of life. So these are some of the disorders which we are going to talk about. And of course, mental health issues like depression, anxiety, and bipolar disorders, they will all be covered in next 1 hour, and with these eminent speakers. And we will start the session with the questions, and Dr. Rajesh Keshri will be asking the questions, and I will be intervening the answers as well as the involving the other panelists. Over to Dr. Keshri.
Thank you, sir. Thank you so much. So I think I would like to start with something which has fascinated me personally since childhood, and I'm sure many of the audience would also be interested. And this is the memory aspect of the brain. Why do we remember things as we do? How do we remember And is actually memory considered to be a marker of brain health? Dr. Anand, would you like to contribute?
Very good question. The brain is a very complicated organ in the body, has billions of neurons. The brain cells we call the neurons. And there are trillions of connections we call synapses. So memory is a one aspect of the brain. There are so many cognitive functions, among them one is memory. Memory is basically the ability to new learning. So the basic substrate, basic part of brain which is concerned with memory lies deep in our temporal region we call hippocampus. So that is basically concerned with the new learning memory. And then we have prefrontal cortex which tells us about the awareness, the orientation, then what we call the executive functioning of the body. So these two structures are the main structures which are interlinked. The hippocampus, the prefrontal cortex, and the limbic circuitry. So all these are concerned with memory.
So in addition to that, I'm sure that everybody would like to know how to improve your memory. So that is what we normally talk about, that the people start forgetting where they have kept the keys, where they have kept the spectacles, or small things in our daily life. We all have, that's also called benign forgetfulness. So how can we deal with that? Is it a memory loss? Is it people are scared that I'm getting dementia when I lose my keys or when I forget my appointment? How do we know that it is just a aging process or a benign forgetfulness, or it is a dementia? And if there is something like that, then how can we improve that cognitive function of remembering things or improving our memory?
Just want to highlight, all of us in day-to-day, we forget, we have kept keys somewhere, spectacles somewhere, or we forget to latch the door or so on. So this is not considered to be memory loss. It is a highly competitive world. We are multitasking. So if once in a way it happens, that is not considered to be a memory loss, or we call it dementia. When it occurs repeatedly, over and over again, and over a period of time, then we label a patient as memory loss. So just keeping a key somewhere and forgetting is a normal part of life. So how to improve now memory? Memory, we have what we call the thing called cognitive reserve. So certain areas of brain are prone to get damaged. These are basically, there is an abnormal protein. With aging, what happens? As the person ages, certain areas of brains, there is an abnormal protein which gets accumulated, and it stops the transmission from one cell to another. So there the problem of memory starts. So how there are areas we call cognitive reserve, or we call it brain health or mental health. Brain health is basically, we talk about the structural part, the loss of cells, loss of synapses, loss chemical abnormality in the brain. Whereas the functional part is called mental health. So there's a difference between brain health and mental health. So how to improve? So basically, what we tell that we should, after 50 or 60, the problem of memory starts. So what we tell a person when he starts losing, you keep using a brain, use it or lose it. So keep reading one thing, that newspaper every day, or keep your hobbies alive. Like we have a hobby of reading or novel, etc. That you should keep it doing it. You should not say, I have done, my life is done. I have spent 60 years in a government service, I retired now. So this is the time I should go and relax. Never relax. Keep the brain active all the time. Other things which could help is, apart from reading or keeping the hobbies, that you should listen to music, and also keep your hobby, like gardening, simple thing. Don't sit idle. Do gardening, listen to music, or try to learn new languages. The studies, it has shown that person who, even after 50s, 60s, tries to learn new language, the memory improves. So there are so many ways, and even keeping a pet. Keeping a pet is like a whole day work. So you have to look after the pet. So that also, the studies have shown that keeping a pet, keep engaging oneself in the. So that's a couple of points I could tell you at that point in time. Yeah.
May I add
Yeah,
something?
Dr. Sethi,
sure.
please. Yeah.
Very nicely put across. There has been a great kind of changes now. That if you want to keep your brain health, the most important thing is, as he has told you about keeping the brain engaged, biggest thing which has come is the physical exercise. Physical exercise does not only keeps you healthy physically, but it has a great influence on mental health. Very important, very, very important, and that has to be emphasized on all ages. Very important. In addition, the mental health has been emphasized that you should keep doing the puzzle. The third aspect which came, especially in aging, aspect came, you have to have a feeling of being important. That is not being kind of thinking proud, but you should be have a pride in yourself. If you lose that thing, your personal pride, the day you go down, especially when you are aging, it depends, somebody put it across very nicely, that if you have retired, if you go out of your house, if you wear a pant and properly dress you go, or you just walk out in pajamas, that makes all the difference. The third thing which has come, which has been, yesterday I was told, it has been discussed, is the diet. It all depends what you eat. The brain health is depending on what you eat. There has been very, very important composition now of diet. The day you feel what is called in Hindi Satvik Bhojan, not Tamsi Bhojan, you feel light, you feel energetic, you feel like working, you feel even mentally very healthy. Fourth thing which is very important is good sleep, which has been now emphasized in a very big way. Your sleep should be really good, and you should be sleeping very well, especially the part where you get kind of thing which you can even remember and your memories are there. That sleep is very important, and if you feel that you can do without sleep, because modern world is becoming where it is, you are multitasking, and you feel very proud saying I am multitasking. Now people are really shifting back that you should be intentionally focusing on one thing and tasking. So there are pendulum swinging, but you have to choose your way in between. So sleep is very important. Gut has a great effect, what you eat, on mind. More and more now in Parkinson has been mentioned about Dr. Dhameja. Nowadays feeling that it might be starting from your gut. Then in fact, recent discussion they thought maybe a day will come, you can take a biopsy from intestine or from rectum and come to know whether this guy is in future going to get Parkinson or not. So I think in addition to you think of mental, that keeping mentally engaged, the physical training, even if you take regularly walk half an hour in the morning, half an evening, very important. The second is mental engagement. Third, feeling proud of your achievements, feeling proud of what you've done is very important. There was one of my friend, he used to quote William Osler. William Osler is a kind of guru to us in the modern medicine. William Osler, he tried to emphasize his philosophy in three things. He said, do the best that day. When you are doing a thing, do your best. Forget about tomorrow. Tomorrow will take care of itself. Then second point which emphasized William Osler's philosophy, that is a golden rule. What is the golden rule? Which is said in biblical terms, have kind of feeling of giving, that you should be able to give people, give nice thing, contributing something, even giving money, feeling of pleasure and happiness. The day you get up and you feel good, you start feeling really good. So it is a kind of thing where you can really feel good and do it. Then be very fair in your dealing with people. Nowadays the atmosphere which is vitiated is become very, very difficult. You have to be thinking fair, and you should be doing justice to other people also. Have a feeling of that you are contributing, giving donations, giving feeling this. Last, when you are saying in this, that you should contribute this. Last, his philosophy is so-called that you have to have equilibrium. You have to have equanimity. Equanimity of mind is very important. This is recently when you know why suddenly the Indian cinema has become so popular. We won 2 Oscars, and if you remember your philosophy of seeing the films, in Hum Dono film, a song, मैं जिंदगी के गम भुलाता चला गया. The middle line is very important. यहाँ पे मुझे गम और खुशी महसूस होना जहाँ मैं दिल को उस मुकाम तक लाता चला गया. Equanimity is that kind of feeling where you don't feel so sorrow, that does not disturb your mind, and your failure does not remember. At the same time, when the success comes, it doesn't go to your head, and you feel proud and you are moving around. So that is the thing. There's another Hindi movie which you have really seen, because why I'm quoting, because Oscar recently, 2 Indian movies won the Oscar. That is in Idiot. 3 Idiots, where they say, Sab theek hai. Everything is well. Even when he tells the girl who is pregnant, the child kicks that there's a well-being. So that is what this conference meeting is, that mental health and well-being. That even child in womb, when he is told everything is okay, everything is well, is really kicks. So therefore, William Osler's philosophy of 3 things, if you could examine in your daily living, may be able to give you a mental equilibrium and mental well-being. So the things which are moving from in the world now, from so-called diseases, we are moving to preventive health, preventive brain care. That we should see that we prevent our brain rather getting into the problem from childhood to the adulthood. Very important. Because child when is born, he is coached by his parents, who hopefully are good-minded and teach him good things. Then child learns a lot of things in his peers with school where he goes. He learns from where he fellows with the plays, and as he goes to school and colleges, he learns from them, and then he learns from society. In turn, the society learns from him. So if there is a well-being of healthy mind, he will have healthy kind of feeling to society.
Sure,
the
sir.
big question which is coming, whether brain and mind is same. That is what I want to know. Whether brain and mind is same. You don't, is it same? Is the mind and heart, has been emphasized that brain, the heart is just pump, which pumps the blood to the brain, which is our biggest kind of computer, which beats all the supercomputers. So that remains healthy, which controls even the heart and controls all vital functions, even blood pressure, which is the seat of all our emotions, sorrow, joy. So it's very important that we keep our brain healthy.
Thank you, sir. Thank you so much. And indeed, sir, a few of your last sentences have been in sync with what we are doing. The Illness to Wellness campaign, which has been going on since 2014, to bring preventive healthcare or health prevention as a mission. And thank you so much for your words. I think we are going. We would like to welcome Professor Gangadhar, sir, who's just joined us. Welcome, sir. Thank you for coming.
Padam Shri Professor Gangadhar, who is the ex-Vice Chancellor of the NIMHANS Bangalore, and currently he is the President of the AMRB, National Medical Commission, which regulates the medical education in the country, and he's been playing a big role in capacity building, producing more and more doctors and specialists. After he has joined, the number of postgraduate medical seats have almost doubled now, and this is a great contribution to the Indian healthcare system, which is we are trying to improve. Welcome, Dr. Gangadhar. Thank you for sparing time. I know he was busy in Niti Aayog, and he had another meeting in Niti Aayog, so he had to cut short that meeting to be present with us. We are really grateful to you.
Thank you.
Thank you so much, sir. Thank you so much for joining us. And we had the pandemic of COVID, we all realized, but then we have the pandemic of non-communicable disease, especially diabetes, coronary artery disease, heart disease, through which we are going, and we are very frequently listening about deaths happening because of these. And little do we all realize that this is something very intricate and important to our brain, because the same process of clotting happens in brain. It can be a life-threatening illness. So I would request our panelists to throw some light on this, and I'll start with Dr. Achal, sir.
So what you talked about, we often call them risk factors. Stroke, as you all know, is a third leading cause of disease and also second leading cause of disability. So in that sense, we must do something to prevent it. And in order to prevent any disease, we must know the factors which are responsible for that. The stroke, as you all know, it is happening because there is some problem with the brain flow, blood flow. As soon as blood flow stops, then the part of brain where the blood has stopped will not work, will not perform its function. So like if that part was moving your upper limb and lower limb, that will stop working. And this is the most usual scenario where you find one part of body not working, one side of body not working. Sometimes face is also involved, sometimes speech is involved. Specifically, if it is happening on the right side, speech is gone. So this is a difficult scenario for any person. So in order to know how to prevent this, as I said, we will have to know the risk factors. So as Dr. Saab was talking about non-communicable diseases, diabetes, hypertension, these two are most important risk factors which we need to prevent. There are other factors as well, like smoking. This is very important factor responsible for stroke. And then alcoholic. Then there are several other diseases where in obese people, people who are having OSA, these are those factors which, I mean, you can act upon and do something. There are some factors where you can't do anything. Like it happens more commonly in male people, more commonly with aged people. So these two are factors where you can't act upon. You can't change your age, right? And also there is family history. There are various genes associated with this problem that also you can't change because you are already born. So you need to act on them to prevent the occurrence of stroke. So stroke, one more thing I would like to tell, there is another kind of, one is clotting. Clotting means the artery which is supplying particular part of brain is blocked because of clotting. The another type is where there is the artery ruptures. Then blood comes out and again the same scenario happens. Part of brain stops functioning and the part of body which was being governed by that part of brain stops working. So again, from outside you find the same thing. One side of body is not working, the commonest type of stroke. There are other kinds of stroke. As the discussion progresses, we may go on that or we may not touch upon that. However, the commonest is one side of body not working. So to prevent that, we have to act on risk factors. If you have diabetes, hypertension, then you have to control that properly. And how to prevent diabetes, how to prevent hypertension not happening, we will be discussing later. And of course, those two factors like smoking and alcohol, those are well within your control. You have to be tough enough to stop that. Thank you.
So
These are the modifiable factors which we are under our control, like alcohol, smoking, physical exercise and diet. So these factors contribute a lot to the occurrence of either blocks or bleed, both. Probably the stroke is caused by two, as Dr. Achal said, either block or bleed. Either the arteries which carry blood from heart to brain are blocked, or the artery ruptures or the bleeding is there. So either blocks or bleed. But one thing more to add is that, of course, we are talking about preventable and wellness. But illness is also there. Once somebody has a stroke, now it is treatable. So our emphasis should be to bring that person or the patient immediately to the hospital, so that newer medication which are clot busting drugs and which can only be given within specific period of time, say 4.5 hours of occurrence of stroke. So that patient has to be immediately brought to the hospital so that his clot can be busted or clot can be lysed. or clot can be dissolved. So it is very important to create awareness about stroke. If it happens, then you bring the patient immediately so that the patient can get benefit of the newer treatment, which are the clot busting drugs, and patient can become all right. So that is something message which should be given, that once you have somebody has a stroke in your family or in your neighborhood or somebody known to you, then don't take that patient to here and there or small hospitals or clinics. Take them to the big hospital where these facilities of clot busting drugs are available, and sometimes there are other medications, other procedures which can be done in 24 hours time. So it is very important. The other thing is rehabilitation also. Once some patient has a stroke, there is a process of rehabilitation so that we can bring that person to maximum to the normal life. So that is very, very important.
Sir, we need to act fast. So in order to act fast, we need to understand the fast. So who would...
So the FAST is acronym which is used for the symptoms or the recognition of stroke. So the FAST, F is for face. Somebody has a drooping in the face, or the angle of the mouth goes on one side. So drooping of the face for face, F. A is the arm. If you have got a weakness of the arm or leg, that is important, A. S is for your speech. So that means if there is a difficulty in speaking, or patient is finding difficulty, word finding difficulty, or not able to understand what is being said, so that is speech problem. And T is for time. Time is the essence. So golden hours or 4.5 hours. So FAST you have to remember. We have also added two more, B and E. B is your balance. If there is a sudden impairment of your balance, you are not unsteady on your feet, or you are getting giddiness. And E is for eye. If you sudden loss of vision in one eye, can be because of stroke, which can happen in elderly individuals or patient with risk factors. So these B fast, BEFAST. So you have to remember that, and that's very, very important for awareness, for recognition of stroke, and bringing the patient to the right place at the right time, so that patient get benefit of the treatment.
Thank you.
I would just like to add, as has been emphasized, hypertension, diabetes. What I am seeing the most when I take rounds, young people having stroke, and then it is found that he is smoker. Sometimes he dodges you. Smoke करते हो? नहीं करता. Now I learned to ask, कब छोड़िए? कल ही छोड़िए जब कल ही छोड़िए. तंबाकू लेते हो? हाँ, कभी कभी लेता हूँ. Then he is taking manjan of tamaku, or he is taking tamaku which is pisa hua tamaku. So you have to really go after him. Then many times I tell him, listen, diabetes I can understand, because you cannot choose your parents. If one of your parents had diabetes, probably you may also get a diabetes. One of your parents might had a hypertension, you may get a hypertension. Those are things which you learn to prevent from very beginning, which you should be aware of. But this is self-inflicted injury. Tamaku to tumne liya hai na. But the most difficult thing is to stop them asking smoking. My team always goes with me. They really, one day, this guy said he had a dense stroke and very difficult to talk to, feeling very kind of important, lying on the bed. And I said, ये सिगरेट बंद करनी चाहिए, तुम्हें तंबाकू ले दे. कहता डॉक्टर साहब क्या हो जाए? मर ही जाऊंगा ना. Now my team which was going, they knew that I am so anti-smoking, anti-tobacco. They did not know how we'll handle it. I said, yes, दोस्त मर ही जाओगे. नहीं, मैं मरने के बिल्कुल scared नहीं हूँ. मैं कहा ठीक है. मैं कहा दोस्त बात सुनो. नेक्स्ट टाइम जब तुम्हें स्ट्रोक होगा, राइट साइड चली जाएगी, स्पीच चली जाएगी, और उसमें जब तुम उठा के लाए जाओगे तो तुम बोल भी नहीं पाओगे मुझे क्या तकलीफ है. ये तो उसी तरह पिक्चर में हो गया, लल्लू वो भी जीना, कोई जीना है. I went and left. Next day when I came around, I was surprised. He said, I understood your message. I'm going to stop smoking. You really have to put a lot of pressure, lot of weight, not getting angry that there's something bad. He has developed a habit. You have to really sometimes make him understand, sometimes really request him, sometimes really overpower him, and try to explain to him that next time you may not be lucky that you were brought in time and you got the drugs and you recovered. Therefore, it's very important that tobacco is really killer. And this is not kind of thing they try to hoodwink you, मैं तो बंद कर दिए. Then you have to say कब बंद किया. So this is the way they function.
Thank you, sir. Thank you. I think sir has given some very important messages, and one message which I personally feel that he's reinforced from where Dr. Anand sir has started is building the cognitive reserve. You see, he's been watching movies and he's been picking up such good messages from those movies. Maybe we might have, we all must have seen those movies, but perhaps we couldn't pick up those messages. And one very important thing that he has ended up his conversation is the role of stress probably in the patients that he was talking about. They're ready to die of illness. Not only people are dying, young people are dying, people are committing suicides. The rate of depression and anxiety in our society, despite so much affluence, and especially in urban cities, in metros, we hear almost every month some famous actor in Mumbai, in Bollywood committing suicide for different reasons. So thankfully Professor Gangadhar is here with us. Sir, I would like your opinion on this.
Yeah. At the outset, apologies having joined little late to this meeting. Illness to wellness, very appropriate. Illness, the patient is driven to seek help. The responsibility is that of the doctor to an extent. Wellness is something that doesn't incentivize the individual. But we know that having a better wellness ensures the illness is prevented. While we as doctors, we keep saying that the illness has to be prevented, and then we go on to give a lot of rules, a lot of tips as to how to prevent the illness. But promoting wellness is something that I think we all have to keep in mind. Empowering the individual, empowering the public, empowering the person who is potentially going to develop an illness, which will probably be one of the good alternatives to prevent an illness, particularly when you are talking of non-communicable illnesses. Communicable illnesses, of course, you have the vaccinations, etc., etc. Non-communicable illnesses, these are the reasons why we have to promote wellness. And how do you promote wellness? How do you incentivize wellness into this individual? This is a challenge that we have been faced with in the recent times. And as you can see, the entire movement of health services in our country, from the hospital to primary health centers, and now we are now calling them as wellness centers. If you can see, the movement of the health services that has happened is to bring in the issue in the public, how to promote my own wellness. There are very many means of promoting wellness in the individual, and if you don't, like he mentioned, psychological distresses and also aging related cognitive decline, both are very important. How do you healthily age is another issue which has again cropped up. I'll come to that a little later. But the point remains, how do you promote wellness? Promoting wellness is at different ages, different strata of people. You have different strategies that you need to adopt. But one common thing is, which is now being talked about, if you go into the National Institute of Health recommendations, which talks about how to promote good brain health, for example, one of the mentions they talk about is reduce stress. Amongst the many other things, physical things that were mentioned here, ensure your physical exercise is very well done, you ensure that you are away from the intoxicants, you ensure that you develop a great degree of resilience to handle missing things, etc., etc. But one of the things that they do mention, which is very common to many other things, is how do you ensure that you have least stress? How do you avoid getting stressed very much? But that is easier said than done. All of us are stressed, just that I had to come halfway through a meeting through this place is also a source of stress. that I have to tell them that I have to excuse myself, and they will have some difficulties, why you can't stay, so on and so forth. But the question is how one can master this stress. I'll just give 2 or 3 tips, maybe you can go on with more questions later. One of them is the practice of yoga and meditation. Because yoga itself is a meditation, and recent years a lot of research has poured into this, a lot of academics has been done, evidence has been building, and in fact very recently there was a very good review that talked about brain health, wellness, healthy aging. Is yoga a fad or is it a fact? And they have found literature evidence to suggest that it is in fact a fact, that there is a lot of data that has accrued. We say very typically in our Sanskrit saying, Chita dahati nirjeevam, chinta dahati jeevanam. When you are continuously stressed, the chinta will ensure that we ourselves start decaying because of, and the brain is the first one to suffer for that matter. And how do you prevent that is to be able to master the effects of chinta on my body. Chinta itself I cannot prevent, but the effects of chinta on my body I can prevent. One of them is, like I said, yoga. There are benefits of yoga which have been documented. One of them is reduction in the levels of cortisol. And glucocorticoids get released when a person is continuously stressed, and longer they remain very heavy, very high, and it is known to damage the neuronal cells. The cells are gone. Otherwise also on a day-to-day stress we are losing some cells, but it is going to accelerate the loss of cell. In fact, glucocorticoid toxicity on the brain is something that has generated a lot of interest in the recent years. And so we have to reduce that elevation of the cortisol, and it is very well known that yoga, even in healthy individuals or in the ill individuals, like for example depression, where the yoga has had a potential to reduce the levels of cortisol. And this generates a cycle. If you don't reduce the cortisol or the glucocorticoids damage the brain and also prevent the neuroplasticity. The brain repair mechanism by way of this chemical called as the brain-derived neurotropic factor, which actually protects and helps to repair your brain, that levels drops when the cortisol levels go up. And as a cycle, the brain loses its gray matter and the brain shrinks, and the most sensitive part of that is the hippocampus, which shrinks first. With age it shrinks, and with stress it shrinks even faster. And so yoga has been introduced, and yoga has had beneficial effects to promote wellness, healthy aging, and in fact there are a good number of studies which show that long-term practitioners of yoga have retained more gray matter compared to the age-matched controls who did not practice yoga. I am not saying that yoga is the only one. Physical exercise, good entertainment activities, also healthy entertainment activities also promote this brain repair mechanisms. But yoga has been demonstrated to do this, and it of course increases the cognitive reserve as a consequence. And yoga has had beneficial effects not on these factors, cortisol, the brain-derived neurotropic factor, repair mechanisms, the benefits in terms of retaining your gray matter. People are now trying to see in a long-term effect, does it have benefits in terms of reducing the age-related complications of brain decay. In fact, the Karnataka government, with the help of other agencies, has launched this brain health initiative. Of course, it includes prevention of stroke, head injury-related complications, but also facilitate a better cognitive reserve with this individual. As the individual progresses into his life, he continues to remain healthy with respect to the brain function as much as possible, away from these stress-related psychiatric disorders and also stress-related consequences of a brain disorder, which of course is senescence and cognitive loss during the senescence. So maybe more questions would crop up. I would be very happy to take it up at that point of time.
Thank you so much, sir. Thank you so much. One more problem, I think, of which Dr. Tamija sir has just talked about, that plagues our country, is epilepsy. In cities, we realize that epilepsy is a disease, it is treatable, people have access to health care. But in villages, you know, doctors are not there, people are not there, not aware of this as a disease, so they take it as some external forces. So, Dr. Tamija sir, would you expand on that?
I'll just introduce the topic as such for the general masses. So, epilepsy, we have more than 1 crore people living with epilepsy in India, which are underestimation and underreporting. I think they are much more than reported in the numbers. So, epilepsy is mainly because of the two reasons broadly. One is the genetical prone individuals which have the epilepsy, and we don't know the other causes, which we call idiopathic or unknown origin epilepsy. And the second is epilepsy because of the infections, which are much more prevalent in our country, like tuberculosis and bug called neurocystic cirrhosis. So these two types of infections can cause epilepsy, and these are preventable and treatable if you maintain your hygiene levels and you maintain your good life practices. You can be prevented from the epilepsy. Third is our symptomatic or epilepsy because of the, say, head injury or structural causes in the brain. So these are three broad areas of epilepsy. And epilepsy is a very social problem in our society, and people tend to hide it. People tend to go to different other, they think it is bhoot pret or it is upar ki kuch problem, ye problem, wo problem, and people tend to make those maneuvers ki kisi ko juta sungha diya ya kisi ko chammach dal diya. So all these things should be avoided. So we need to create awareness about what is epilepsy, how we can prevent it, and how we can treat it if it happens. So I would request Dr. Anand now to talk about how to prevent epilepsy and what is the first aid if somebody has a seizure or a fit on the road or in the house and you are alone. What can you do to prevent the hazards or the consequences of having an epileptic fit, which is actually a very frightening scene, but it lasts for 1 to 2 minutes only. But we need to know certain basic first aid measures which can be instituted immediately if somebody is having a fit. Dr. Anand.
First of all, whenever a person has epilepsy, he is having an attack, what we should do or we should not do. First of all, we should make him comfortable, loosen his clothes, and never try to put, no one tendency is people try to put finger in the mouth. You never do it, or a piece of wood or chammach or spoon. Never do it, because this will harm the patient. Because patient teeth will break and it can go into your respiratory tract. So never do that. Secondly, just make him lie on his side so that his tongue doesn't fall back and block the respiration. Make him to the side, don't insert anything, don't give any drug, and don't do, as Dr. Tamija said, don't give a shoe to smell or onion to smell. This is a normal tendency, because the duration of seizure, one seizure is 2 minutes maximum. It stops after that, normally. So giving a shoe to smell or onion to smell will not help. Even some people give a key in the hand. So, but normally it would stop. The duration is less than 2 minutes. So one should not do all that. And where can we prevent epilepsy? First of all, the common cause is most common in children. So whenever there is delivery, it should be in the institution. Never have a home delivery. Most of the causes of epilepsy are because of reduced blood flow or reduced oxygen to the brain. We call hypoxic injury. So if we tell in the rural areas, whenever there is a delivery, it should be done in a hospital. So that is the one way you can present. Second common cause is head injury. So we see young guys going on bikes, not wearing helmet. So wear helmet. We should enforce. The law is there, but the young people, they don't follow the law. And these are the two main which can prevent. And third thing is hygiene. As Dr. Damir said, there is an infection, we call a worm in the brain or cyst in the brain, cysticercosis. So if we take care of hygiene, we take raw vegetables, you should wash them properly and never take raw vegetables without washing and cook them and have it. So these are the three things where we can prevent epilepsy.
Thank you. Dr. Gangadhar, the epilepsy as well as mental health problems both have a social stigma with us. And many of the epilepsy patients, epileptics, also have a mental health comorbid conditions along with that. So how we should address these issues, mental health, epilepsy, and other mental health disorders which are not openly discussed in the families or in the society, and people make it a stigmatization. Somebody is going to consult a hospital, in the mental hospital, oh tum to mental hospital chale gaye. So these things, now we are coming out of this. Where do we go from here in terms of wellness and illness?
Stigma has been a dogging problem for centuries, I'm sure. As you can recall, the psychiatric patients were chained and kept with a hope that when they are unchained, if they're chained, they will at least won't go and communicate to the other individuals or disturb other individuals. Thanks to many revolutionaries, many people who were reformists, who unchained these patients, and then the source of humane treatment started. But nonetheless, in the public mind, particularly epilepsy, to say that somebody is epileptic and getting treatment is something that they feel very shameful in the family. The best is not to give treatment. But the point is, it is going to make things worse. They are going to be getting attacks of seizures again, and worse, attacks in front of other people, which is going to be even worse. It is simpler to accept that it is some other illness like diabetes or hypertension where I need to be taking. Whereas in these two conditions, perhaps you have to be taking treatment for lifelong, whereas in epilepsy, for a sufficient period, if he has been epilepsy-free, he could even perhaps come out of the medicine. So is the case with psychiatric disorders. Very small proportion of psychiatric disorders would probably end up having to be treated for a long time, lifelong. Most people can get away from the treatment, get well, and be able to lead normal life. That is the case in international literature as well. What you see generally in the streets for untreated people who are in the hospital, who have been the ones where illness couldn't really be gotten well. But that proportion is less than 1% of the entire population affected with psychiatric disorders for that matter. So people over these years have been able to change their mindset. Thanks to many of the celebrities also talking about psychiatric illness, etc., and people are now beginning to accept that psychiatric illness is not something that need to be really stigmatized. So this situation is changing, and thanks to COVID, when people realized that psychiatric distress is something that they have to seek attention. Telephone helplines were flooded with these conditions. When we were able to explain to them on these telephone helplines, there was a lot of relief that was obtained. And so much so, the government recognized the impact of this tele-intervention in psychiatric disorders, and so instituted a huge budget in the previous financial year to be able to take what is called as a telemanas, be able to be available for any psychiatric health counseling rather than having to go to, like Dr. Damija mentioned, to a psychiatric hospital which they feel distressed. In fact, most need not go to a psychiatric hospital. Most can get help on telephone lines or even on single consultation in a clinic of a psychiatrist. So this is possible, and to popularize this facility to be able to be reached very early through the technology that is now available, and also make sure that mental health has been given a lot of attention. So this is now possible. Maybe at some point of time, since the moderator had mentioned about suicide, I'll perhaps be coming to you a little later on that subject. Thank you.
So we have had a lot of discussion about the diseases, about the illness part of our initiative. I think we need to come to what Sir has just described, the journey towards wellness, the journey towards wellness has only one incentive, that is to prevent illness. And I think the pillars of brain health probably lie in those simple things that we've been talking about. And the one, perhaps the most important thing, is diet. A good diet for brain health. So we'll start with you, Dr. Anand sir. What is a good diet for the brain health? And I would request all of you to contribute, because diet perhaps is one and only topic which interests all our patients. At least all patients who come to a doctor, the first question is, Doctor साहब क्या खाना है? तो पहले तो क्या खाना है?
It's almost similar to all other conditions. We call it lifestyle changes or lifestyle modification. Diet is one. So we tell them have a balanced, as you all know, balanced diet with a lot of green leafy vegetables. And we also tell them Mediterranean diet, where we stress upon have a lot of legumes and blueberries, which are good for the brain. And of course, all of you know that fat, cholesterol, saturated fat is bad for the brain. So one should use polyunsaturated fatty acids. And so basically you have a healthy diet with low salt, low fat, low sugar. These are the basic crux. And over and above, we can have a lot of fruits, vegetables, and green leaf vegetables. That is good for the brain. And basically, we talk about Mediterranean diet, where we take a lot of green leafy legumes and blueberries. Yeah.
I have a question to Professor Gangadhar sir. Now, there's a lot of discussion, especially in social media, that diet has profound impact on the way we think, that diet, the changes in diet can bring about decrease in the level of anxiety. So is it true? Are there any special things which you could recommend?
Although I do not claim great knowledge on this in a scientific sense, but recent years we have been talking about integrative medicine and concepts from the Ayurveda, where they talk about sattvic diet, rajasic diet, and the tamasic diet. So the specific ingredients are perhaps right now difficult for me to explain, but nonetheless, the tamasic foods are referred to as those who have been stale, kept in the refrigerator, uncooked for a long time, or cooked a long time earlier and have been kept there. And which generally people talk about the so-called fast foods are referred to as the tamasic foods, which generate a lot of static conditions. Person becomes not very mobile, he tends to, or he or she tends to put on weight, and he becomes less active and then depressed and so on, these conditions. Then there is something called as the Rajasic diet, which of course, Rajasic is something that is required, which is required for us to be active, physically well, and so on and so forth. The Rajasic diets, as what was mentioned here, good amount of protein, balanced diet is what is called as the Rajasic. The Sattvic diet is also equally balanced though, and these are all components which include you don't have fresh food, uncooked, bunch of fruits, and these conditions have also been promoted to have people have been talking about the Sattvic food promotes true wellness, transcendence, compassion, empathy, and so on and so forth. Rajasic food is something that is generally considered as healthy and keeps you going if it is in a balanced way. Tamasic food are best avoided as far as this is described in Ayurveda. And Ayurveda, of course, goes on to even further refine it from different physiological states of an individual, starting from kid to elderly, pregnant woman to the illness individual, or to the seasons for that matter. In terms of the rutu, what they say is different seasons, different foods have to be eaten. And these descriptions have been so well laid in Ayurveda, and I'm sure people are now importing many of these concepts into what is called as a lifestyle medicine, which people are running some short-term, long-term courses and so on and so forth. But it is very important that we pay a lot of attention on this what most commonly known as the patya. That is, what is it that I need to use appropriately? And when allopathic doctors like us, when they ask us, we generally slight it. We really don't. Whenever they are ill, when they are asking for some treatment from us, after a prescription, they will say, what foods I can take. But it's general reaction from all of us, which used to be from mine also for a lot of time in my younger days of my practice. It is not something that is serious. You can eat whatever you want. But that is not true. In the last 20 years, people are now becoming more and more sensitive about these diet practices, which are very important. Thank you, sir, for mentioning this.
Thank you, sir. Professor Damija, sir, this question is to you. Now, before exams, my mother used to make something we have Kamal Gatta ka halwa, that is, and all of say that, improve, take some badams, almonds to improve memory. So do all these home remedies have some effect on memory, functioning of the brain? Is there any evidence? Would you like to elaborate?
So all these home remedies which we call memory enhancers, in the science there is no very robust evidence for that, but of course the faith is there. Badams, of course, they are rich in polyunsaturated fatty acids and other things, and all nuts actually, they are very good nutritious in terms of balanced diet. But from the aspect of memory enhancer or memory, how to improve your memory, there are few very, very key messages which we want to give it to the audience. One is, of course, the physical exercise, as Dr. Sethi mentioned about that. So exercise is a new medicine. So take this 30 minutes of brisk walk every day for 5 days, or 10,000 steps every day for 5 days in a week. So that is very, very clear message that half an hour of brisk walking either in the morning or in the evening. It gives you not only the physical fitness, it also gives you cognitive fitness. It produces the happy hormones, what we call antidepressants. So that is why walking is a new medicine, and it is a part of now lifestyle medicine. So inculcate in your life, whether it is weight reduction or otherwise. Of course, weight reduction is one aspect, and diet and weight are both combined, and BMI, which is ideal BMI less than 24 or 25, that is depending upon your height and weight. And weight reduction, obesity is linked with almost all diseases, including the brain diseases, sleep disorders, diabetes, hypertension, coronary artery disease, heart attack, strokes, everything is related to obesity. And the best way to cut down obesity or the diet is reduce your portion size. If you cannot cut down your number of items, but cut down your plate size, cut down your katori size, cut down your portion size so that you eat less than what is required. I am not going into calorie intake 2000 or 1200 or 1800 depending upon your work environment or sedentary lifestyle or very active lifestyle or a heavy lifestyle. So that is variable, but certainly if you are overweight, if your BMI is high, cut down your portion size. Take everything what you want to take except for all these fast foods and uncooked food or canned food, which Professor Gangadhar just alluded. Otherwise, take a lot of fruits. Cut down your salt to half, cut down your sugar to half, even if you are not diabetic. And take a lot of colored fruits, whether it is bananas or pineapple or mangoes or green or red or whatever. So add colors to your diet. So that is very, very important. The other thing is, of course, the related to diet is your whether it is non-veg or veg, a mixture of having a vegetarian diet rich in B12 or all the vitamins. B12 is of course not very rich in vegetarians, but do periodic checkups with your nutritionist or with your physicians, and according to your baseline levels, the diet is there, and that diet is also linked to your memory, and memory is depending upon your underlying conditions. If you all these 2-3 things which I mentioned, the physical exercise and the nutrition and the cognitive fitness, these 3 things are important for the cognitive reserve or the cognitive fitness in addition to the physical fitness.
One more thing I would like to add with all that. We heard about diet, we heard about exercises, and the other part is opposite to exercise. That means take rest. So not like Kumbh Karna, people have to devote at least 30% or 33% of their life into sleep. So that means 8 hours of a day. So that is very important. That prepares your body and mind as well to work for another 16 hours, right? So you have to take rest of at least 8 hours. That is very essential. Thank you.
So during sleep, our body or our brain regenerates or recharges batteries. So there is protein which was mentioned, amyloid. So during the brain, the amyloid is cleared by our lymphatics. So this is just the medical term, but in simpler terms, brain also excretes our waste products which are accumulated in the brain during the sleep. So sleep is very, very important to recharge our battery and to get rid of unwanted materials, proteins from the brain, which will hamper the memory.
So, Professor Gangadhar sir, I would like to take a little bit of undue advantage of your presence. So tell us how to go to sleep.
So that is very, very important. Thank you for bringing up this issue. Sleep hygiene is very, very important. So bedroom is meant only for sleeping. So no TV, no working there, no laptops, no phones, no screens, whatever screen, whether it is iPad or phone or computer or TV. So bedroom is only meant for sleeping, and that should always be there, number one. Number two, always make a routine of fixed timing of going to sleep, going to bed and getting up in the morning. So say 7 hours or 8 hours means 11 to 6 in the morning, or 10 to 7 in the morning, or 7 to 6. So it is ideally to have a regular routine which should not be disturbed. So we have seen in shift workers and other people there is a sleep problems, and either the people get difficulty in getting to sleep, or once you get sleep you get early in the middle of the night and there is a breakup, or not refreshed sleep in the morning. So you have headaches and you have other things because of not having a refreshed sleep or a good quality sleep. So sleep hygiene is very important, and try to make it a routine which is regular, which is absolutely essential for the recharging of our brain cells. You know, brain cells cannot regenerate. All other cells in the body can divide and regenerate. So we are born with the fixed number of cells, whether it is so many billion or trillions, but we have a fixed number with which we cannot reproduce more cells. So obviously we have that bank account, and we lose brain cells every day or some amount because of the normal aging and because of the diseases. So obviously that reserve of brain cells which should be preserved as much as possible, and these are the things which I told you.
Thank you, sir. We have a number of people here, young people who are working in corporate structures, and their friends must also be similarly working in such companies. A lot of companies are working in offshore projects for the US and UK. So their circadian rhythm is disturbed. So Professor Gangadhar sir, I would request you to speak about this, because as I see in my practice, a lot of people with disturbed circadian rhythms, they develop lifestyle diseases like diabetes, hypertension, and they're also very stressed because they don't have proper sleep. So do such individuals have higher chances of
Yes.
psychiatric disease?
It's very important. And the first note I wanted to make is 1/3 of our day, or the cycle of the 24 hours, we should spend in sleep, natural sleep, without any medication. This is something that we need to perhaps keep reminding ourselves. This is number one. Very important. Sleep is a very important factor. Second issue is our body has a biological clock which switches on and off. So it switches off at some time so that the lights ought to be off. So I believe for whatever may be the progress in ontogeny and phylogeny, we are tuned with the nature. So more you remain tuned with the nature, you are likely to be natural. By natural, I mean you are disease free. So for various reasons, since the world has now become one family, Vasudhaiva Kutumbakam, in practice, it's not been producing the same benefits. We start working in the evening hours to start with, because a lot of clients we have to cater elsewhere and so on and so forth. Our biological clock is forced to be changed. We keep changing the needle from time to time. And once or twice the brain adjusts itself. Second time, third time. After repeated times, it is finding it very difficult to adjust, and that leads to severe stress and stress-related factors, which, as I mentioned. So we have the power to ensure that we remain in sync with the nature, which I mean that we, like a typical a village person ensures that he doesn't eat after the sun sets, or he makes sure that whatever he has to eat most occurs before the noon part of it, when the sun starts becoming less and less. So this syncing of my own lifestyle practices with that of the nature is something that we need to keep ourselves reminding, else we end up with having a desynchronized human clock and a human biology, which is a source of stress to the body and in turn the consequences that we have been talking about.
Thank you. We can have one quick question from the audience because of paucity of time. Yes, please. Please give him the mic. One question. Yes, please.
I have one question, sir. Does asthma and stroke are interrelated? And second thing is about the millet food. Thank you, sir. Is the asthma and stroke are interrelated? And I want to know about the millet food.
Asthma and stroke are interrelated. Sometimes, not always. They are different. One is asthma where the chest problem and the other is the stroke. They may be, they may not.
Okay, thank you, sir.
And second question?
Millet food.
Millet food has come in a big way. Our Prime Minister is now saying millet food, jawar food, they have come and that has come in a way which was a poor man's food. Now everybody is seeking in their house to cook the millet. So millet has come in a big way. There is nothing wrong with millet food. In fact, they are thought to be more nutritious than the ordinary wheat or this. Second thing, the sleep which we have been, nowadays sleep is being emphasized again and again. A walk in the evening before taking the meal may give you good, nice sleep without taking pills. You are blessed if you are getting a natural sleep. Very important. Sleep restores your energy and purges you out of your bad things.
And usually we recommend that no caffeine, no alcohol or no stimulants to be taken before going to sleep, say 2 hours before the sleep. That also produces, awakening cycle because of stimulants in the brain or stimulates the brain cell. So we want to keep them resting, not in stimulating them. So it is better to avoidable caffeine, tea and the other stimulants 2 to 3 hours before going to the sleep so that you can get a natural sleep.
Yes, thank you. I think we had a very engaging discussion. I would request all the esteemed panelists to give small one-line message to our audience. So I'll start with you, Dr. Achal, sir. One message.
So today's theme was how to keep brain healthy. So 3-4 things which we have been discussing and saying many times. One was to do exercises, to do brain exercises as well, and to have a very good sleep so that your brain remains healthy, and balanced diet, of course, which we discussed a lot. Thank you.
Sir.
So I think one aspect of brain health is social cognition or social aspect. So learning a new hobby or learning a new language or learning a new musical instrument, keep solving puzzles and crosswords and sudokus, all these things help to brain exercise, keep brain engaging or engagement so that the brain cells are active and that leads to cognitive fitness. So the new mantra is cognitive fitness in addition to the physical fitness for a better brain health.
I think only one.
No, sir, please.
Brain is your best friend. Never hurt it, never insult it for anyone, for anything. So if you treat it, this is the most precious commodity you have.
Sir.
The central issue is mastering stress, and one of the known means is yoga. Amongst the theoretical part of it is what the Yoga Acharya has said, the principles of Gita. If you can perhaps understand this and follow and help others to follow the health, physical and the brain health, what they said, and also the mental health, more importantly, are all under control.
Okay, sir. Your message, sir.
As I said in the beginning, brain, keep it active, use it or lose it. That is the mantra. Keep on working, don't sit idle. So that makes your brain active throughout your life. Thank you so much.
I would just like to add here that the brain never tires, because it happens when people get elderly, they want to do something. I've seen this myself. Then the other members of the family say, nahi, ab to tum kaam mat karo, itni padhai likhai mat karo, aaram karo. So that's not true. As long as the person can work both physically and mentally, can write, read, they should engage in any possible activity. So now I request that.
No, I just want to give one more message regarding Telemanas, which Professor Gangadhar mentioned, which is a Government of India initiative. Honorable Finance Minister had put 120 crores in the last budget, and this budget also, and Honorable Prime Minister also had a very big webinar on this. So this is a 5-digit number, 14416. I want everybody to remember this number. This is a telephone helpline from the Government of India, which is now across all the states. 51 such centers are working now. One of them is my hospital, Ibhas, in East Delhi. So all these states, we have the 5 regional centers, Nimhans, Ibhas, both of these institutes are regional centers. And this is 24/7 telephone helpline for mental health, for your mental health. Even if you have a little bit of anxiety, there is a stress, there is something which is bothering you, or somebody is having thoughts of suicidal ideation, planning, all these things, I just want to advertise, or just want to make it clear that this is a very useful resource. 24/7 qualified counselors are there, and we believe that 85% of these issues can be sorted out on telephone, as alluded by Dr. Gangadhar also. And if the counselor is not able to sort out the issue, then the call is transferred to the psychiatrist. And if the psychiatrist after consultation is not able to sort it, the patient is brought to the hospital. So 14416, please remember this number, and in case somebody needs that help, there is no need to come to the hospital. 24/7 these telephone services are available all over the India through the central government. Thank you.
Thank you. In fact, I would just like to add here, because I know that Dr. Hameja in hospital has a service where they send out ambulance to patients at their home or in their localities. So if they can just call up, and I understand it's free of cost, and it's a very good initiative. So thank you so much, Professor Hameja. I would request you to give a concluding message or encapsulate our discussion.
So just to summarize, in last 1 hour we have discussed about how to keep your brain healthy. We have touched various aspects, as Dr. Anand talked about the memory problems, and how to keep aging brain to keep engaged, and how to keep your memory sharp, how to improve it, and what are the problems which can happen if your memory is going down or you're finding difficulty. So basic principle is, it's not dementia, it's benign forgetfulness. If you lose your keys, or if you lose your purse, or if you lose your spectacles, it is only when your daily functioning is affected. From your previous level of functioning, say 6 months back, you are doing something and now you are not able to manage your daily affairs, then it is a cause of concern, which we call mild cognitive impairment or a early dementia. So that is very, very important. Professor Gangadhar talked beautifully about yoga, about meditation, about how the Ayurveda and other aspect of stress busters can be used in our daily life, and how we can devote time to keep our brain healthy by adopting simple measures which nature has given us, and our ancient Ayurveda has provided us, in addition to complementing the allopathic way of life. Professor Sethi also alluded beautifully from the messages which we get from movies and other things, and how to have a nutritious diet and exercise, which I said 30 minutes of exercise every day, brisk exercise, whether aerobics or not, 5 days a week, 150 minutes per week is crucial to have your brain healthy, to improve your cognitive fitness. Professor Achal talked about risk factor of stroke, including diabetes, hypertension, cholesterol, diet, exercise, weight, sleep disorders. All are preventable and all are in our hands, apart from the aging and the genetics, which are beyond our control. So modifiable risk factors, we should inculcate our lifestyle changes so that we can prevent from these diseases, strokes or heart attacks and other vascular diseases. So I am again thankful to all the panelists for sparing their valuable time in a working day and be with us to participate and give their expertise to the audience. Thank you very much once again. And thank you Shri Anil Rajput ji, Shri Sandeep ji and Taneja Saab. All of you have been working very hard to organize this summit on awareness, and thank you for giving us this opportunity to share the platform with these illustrated physicians, clinicians and experts. Thank you.
Thank you, Dr. Dhameja and the entire team. Let's have a huge round of applause for a very, very interactive and insightful discussion that we just witnessed. I would now invite Mr. Anil Rajput, sir, to please present the memento to our panelists. Starting off with Dr. Rajinder K. Dhameja. Let's have a huge round of applause, ladies and gentlemen. To Padma Shri Dr. Colonel Prahlad Kumar Sethi. To Padma Shri Dr. Professor B.N. Gangadhar. To Dr. Achal Srivastav. To Dr. Professor K.S. Anand. I would now request all our panelists to please come forward for a group photograph along with Sir. Thank you, panelists. All right, ladies and gentlemen, with that we move on to the next session, which is going to be a very, very impressive and an interesting session subjected around Yoga and Ayush, a boom to new healthy India. So, ladies and gentlemen, to chair this session, I would like to invite Padma Shri Guruji Dr. H.R. Nagendra, Chancellor Swami Vivekananda Yoga Anusandhan Sansatha and President, Indian Yoga